Hi everyone, this is Veronica and today we are going to discuss a very important topic that is related to health sector in India. So we are going to talk about US versus Europe model in India and which model is better for our country or we need some customized model. So all this we'll discuss in detail. For my video updates, you can follow me on Instagram and Facebook. This is a channel StudyIQ. If you're preparing for any government exam, our pen drive and tablet courses are also available. For additional information, you can call us on our numbers here and you can visit our website too. The PDF will be available on our website, which will be available in both the languages, Hindi and English. Now let's talk about its relevance. If we talk from UPSC perspective, it is important in your mains paper 2, health and education. It will be covered here. At objective level, it is not much important, but when we are talking about health sector, so you should know all the government schemes which are relevant in this sector. For example, Ayushman Bharat scheme was there, National Health Mission was there. So they become very important from your prelims point of view. And then at subjective level, a robust and sustainable health policy is the need after hour. So now before going forward, there's a question for you. Healthcare sector in India, what are the challenges and opportunities? So you can write in the comment box what are the challenges our country is facing in the healthcare sector and what are the opportunities we have, and even you can talk about the way forward for the challenges that you will talk about. Now, the context here, as you know, the elections are going to take place in our country now, and there is a swinging point in India's health system story, and this swinging point comes between US model of health sector and UK model of health sector, or you can say the European model. But there are three pillars which remain same for both the models. One is how affordable the treatment is, healthcare system is to the people, how accessible it is and how equal it is for the citizens of a country. Now see, there are different approaches, divergent approaches. Though health is never a political priority in our country, even if we talk about the two main parties in our country, BJP and Congress, we have always seen health takes a back seat, right? So here, however, this time two visions of the future health policy seem to be clearly emerging. Now, one espoused by BJP, there is a centralized hospital insurance driven health system designed on the Medicare model of USA. Right, you know about that. So they totally believe in the insurance system of the health system, and other of the Congress calling for guaranteeing every citizen with access to essential health services which resemble the UK and European model. Now, both these approaches are very divergent in nature, but yet there are three pillars to the health system which are equal to them. One is accessibility, quality and affordability, which cannot be compromised in both the models. Now we'll talk about few concerns here. See, given India's economic condition, which is very fragile, so economic system being fragile, and there are multiple demands in our country which are not withstanding India being the second fastest growing economy. Though we are second fastest growing economy in the world, but still we need a sustainable healthcare system in our country. Now, the two thought streams, as I told you, one by the BJP, that is they want a US model, then the Congress, they want a UK model. So they are embedded in there is a reflection of two value systems. So if I talk about US first, it is individual liberty and personal responsibility, while Europe and countries like Japan are driven by ideas of social responsibility and state accountability. So we'll talk in detail about these two models. Let's first cover the US model. See, the US confines it to subsidized care for poor. So in its health system, there are subsidies, like for example, there is an expenditure of 100 rupees. That means 40 or maybe how much has been decided by the government will be paid by the government. But it remains limited towards the poor people and senior citizens. And even US regulates stringently for quality and allows financial incentives like profits because they want to encourage and boost the technological invention in the healthcare system in their country. But there is a consequence to this. It has over 20 million of its population without access, despite US spends 18% of its GDP on health. So we'll talk about European model now. See, the UK and Europe, on the other hand, they have a different principle here. They believe in the collective responsibility ensuring every individual inherent right to health and well-being, thereby making state develop financial and regulatory system. So here they depend more on state-driven policies for the healthcare system rather than relying on the personal responsibility and insurance system. So here the healthcare services and products, there is equal access to the individuals. That is what the European model believes in. So these countries spend an average 10% of GDP on health with far better outcomes than US. So this has been showed by different research programs also. So now if we talk about equality versus liberty, now try to understand this point that when India won independence from the Britishers, so we inherited the values of European values of equality, but our social strata was very stratified. So society was stratified. We have casteism in our country. So we could not imbibe all the qualities of equality, though there were some where we found the success, for example, in the affirmative action. And over the years, however, the economic and social models trended more along the values of individual liberty rather than the social equality, which was inherited then by the European system of government. Now, moreover, we see a degrading health standards in our country also. Disparities have widened to such an extent that latest data seems to suggest that 1% of India's population enjoys 70% of its wealth. So how unfair it is. We are seeing that the divide between the rich people and poor people is growing, widening day by day. The disparities between the rural population and the urban population is growing day by day. While an Indian is among the 10 richest of the world, we also account for the world's poorest. Over 36% of children stunted due to chronic malnutrition, and half of the population defecating in the open, and nearly 3/4 without access to the tap water. So the rising burden of disease in India is but a reflection of such deprivation of essential and basic social goods and wide inequalities. So what kind of inequalities are there in a country? For example, we see the discrimination across the regions on the basis of caste, on the basis of gender, and on the basis of age also. Now, there are many challenges in the building sustainable healthy blocks. So this is a very important point to understand here, like what is the way forward. You will get it here. Suppose for a healthcare system in a country like India, there are different building blocks, and this is the foundation. So the foundation is primary health care. But in India, from past few years, we are focusing on the above blocks. But if the foundation is weak, these blocks will perish, right? So therefore, we need to concentrate on the primary healthcare system of India, because stacked against an incremental and systematic building of health system blocks, for example, there are countries like Thailand and Turkey. They're very powerful lobbies of health industry because they support a narrow agenda of hospital insurance program. All these countries usually they boost the insurance programs, but insurance programs are the above blocks of healthcare system. You need to understand here the foundation is primary healthcare system. And moreover, the countries I'm talking about here, these lobbies have support of US based foundations and donors. World Bank is there. Then there are medical associations, companies related to health insurance, data aggregation, etc. But the public health approach that seeks to prioritize comprehensive primary care as an entitlement of every citizen, it is clearly numbed out and would require people's movements and participation. Now, this is critical, as with the meager resources of 1.1% of GDP, choices are being made. So obviously we need to increase the percentage of GDP spent on the healthcare system. That could be another way forward. So here we discuss the two way forwards. One is definitely, I'll tell you in conclusion, we cannot even criticize this hospital insurance thing, because no one would argue that hospital insurance is a wrong policy, but then that only primary care should be the focus. That is wrong, but there should be a system hanging on hospitals without the foundation of primary care is a sure recipe for disaster, as it is clearly unaffordable and unsustainable. So definitely here we can talk about the hospital insurance system, but for that we need to keep the base very strong, and the base is the foundation of primary health care. Now see, effective primary care not only reduces 1/3 of hospitalization, but by prioritizing well-being over sickness, it removes the causal factors to diseases and illness. Now it is important here to reiterate the importance of these issues, that the last budget showed a 300% increase for health insurance. Now what will happen over the time with the revision of hospital rates, the cost of the health insurance program will also double, and this will continue to rise. So in the absence of this increase in health budgets, the price will be paid by large swaths of poor people, middle classes, because if we are only focusing on this particular insurance system, so over the period of time, you need to connect it here, the hospital rates will increase, then the budget, the whole responsibility, whole burden will come over the poor people and the middle class people. So its absence, here in the absence, we need to strengthen the foundation, that is the primary health care, because its absence is responsible for the proportionately higher number of premature deaths, 1/4 of global TB burden, and 1 million dying just of want of clean air. So primary health care is something that we need to focus upon rather than focusing upon the above factors. Obviously we need to bring in insurance, but as I again and again I'm telling you, primary health care is the most important. So this is this is all about today's lecture. If you have any query, you can contact me on my social media handles. Thank you. Hi everyone, this is